for taking the time to come and hear our presentation today. We will be presenting on the topic of strengthening the capacity of healthcare providers to mitigate the impact of COVID-19 on African, Caribbean, and Black communities. We'll say ACB because we want to make sure we've covered the diversity within the ACB community. So African stands for those that migrated from the continent, and Caribbean for those from the Caribbean communities, and Black for those people of African descent that have lived in Canada for multiple generations. And so our team of researchers are listed here, and we're presenting on one of our recent studies funded by CIHR, and we are in the final phases of this study. So we're looking at healthcare system and the provision of services during the pandemic. We know that COVID-19 continues to be a challenge for healthcare systems around the world. It's brought about major transformation in the way care is sought and provided, whether it's from in-person to virtual service provided, or the number of visits to physicians or other healthcare providers. For example, the number of visits to physicians has dropped by 13% to about 33% from March to June of 2020. How about the quality of care, patient-provider interaction, lack of skills or capacity to adopt a virtual approach to care, and also were providers able to get or actually care recipient, where they're able to get the care they needed elsewhere if they could not get it from the usual place of care like hospitals. CIHR has some policy response to address the COVID-19 pandemic. They're looking at system adaptation and organization of care, resource allocation, decision making, and ethics. They're also looking at healthcare workforce, and that is where our study comes in, looking at the workforce and the capacity of workforce to address the needs of a particular population that seem to be disproportionately affected by the COVID-19 pandemic. They are also looking at virtual care, long-term consequences of the pandemic, public and patient engagement, and rapid synthesis and comparative policies of the COVID-19 response. Our study particularly is looking at the impact on ACB communities in Toronto and Ottawa. And what we know now is that in Toronto and Ottawa, COVID-19 cases are 1.5 to 5 times higher among racialized communities and non-racialized people. This disproportionate burden on ACB population is resulting not from biological differences between these subgroups, but from disparities in social determinants such as income, education, and employment. ACB communities are more likely to be susceptible to COVID-19 due to lower incomes, precarious employment, crowded housing, and limited access to healthcare, overexposure in frontline essential occupation. Many of the providers, for example, in long-term care facilities are racialized women. And so healthcare providers need to be trained to address ingrained racism in the healthcare system to better control the pandemic. Racial literacy, cultural competence are all key areas that have been highlighted as areas requiring more focused attention. Our entire project, that is the CAP project, COVID-19 ACB Provider Project, seeks to generate evidence to reduce the spread of COVID-19 and related consequences in the ACB community. This particular paper builds on a specific aspect of our study that assesses the preparedness of healthcare providers regarding COVID-19 services in Ottawa and Toronto. In terms of the method, we looked at outcome variables, so we looked at the two indicators that is measured by health service providers' responses to 5 questions pertaining to pandemic preparedness on an ordered 4-point Likert scale. We looked at whether health facilities well equipped with preventive measures, whether health facilities is well equipped to provide diagnostic tests and kits, healthcare providers has enough staff to handle pandemic, and healthcare providers did a good job in handling the pandemic. And we also looked at health policies that are strong enough to prevent future outbreaks. Our results included that ACB healthcare providers were less likely to agree that the pandemic was handled well by the healthcare system, and that current policies are strong enough to prevent future pandemics. Regarding the occupational groups, nurses were less likely to agree that the current pandemic is being handled well by the healthcare system, and that current policies are strong enough to prevent future pandemics. Those working in public health facilities are significantly less likely to agree that hospitals are well equipped with diagnostic resources and have enough healthcare providers to handle pandemic. So in terms of the 2 indicators, we looked at preparedness of healthcare workers and also provision of care to ACB people during the COVID-19. You can see the questions we asked here, whether they're well equipped with, whether hospitals were well equipped with PPE instrument or equipment such as the PPE, and you can see there that quite a good number of people disagree, 6.2, while 41.2 agreed. And you can see in the charts we're showing you here, you look at the second variable, for example, that we've looked at provision of care to ACB people. Again, you can see we asked if they find it easy to provide care for ACB client. 42.5% said agreed, and we have 1.9 that disagreed. For lack of time, I'll keep moving faster. Predictors of health system preparedness, you can see from this variables such as, or factors such as ethnicity and city played a more significant role in terms of their contribution to these variables. You can see the well-equipped hospital, in terms of diagnostic services and enough healthcare workers to handle pandemic. You can see that we've highlighted that in red to show those factors that play more significant role. I'll move to the next slide. So in terms of discussion and recommendation, our findings suggest that substantial variations in the opinion of the providers regarding various aspects of preparedness of healthcare facilities in Ottawa and Toronto. A better understanding of the background factors of the health professionals who express dissent regarding the key limitations in health system is necessary. This could be instrumental in strengthening the service infrastructure and post-pandemic resilience building. Addressing the issue of racism in healthcare system will require a comprehensive approach that includes a collection of race-based data, allowing healthcare providers with foreign credentials to receive training and gain licensing, and also increasing provider capacity in terms of cultural competence, cultural safety, and meaningful engagement of people from marginalized populations such as the ACB community. Thank you, and we will take some questions.